When a national crisis or major disaster occurs, survivors and bereaved families are left in shock. Such mental trauma and suffering also need an emergency psychological response. Now, what is being done by the government and what do we need to be aware of? Eun-jin reports.
As well as injuries, deaths, and destruction, major disasters and crises cause damage to mental health. This is often overlooked because there are no visible injuries, but the impact of trauma on mental health can severely affect one's daily life.
There may be signs of sensitive reactions like anxiety or depression, also habits of avoiding situations related to the traumatic incident, or being intimidated by interpersonal relationships.
What is needed in this situation is emergency psychological support. This is carried out in 3 stages: looking, listening, and connecting. First, we need to be on the lookout for anybody in extreme pain or stress. Trained counselors listen to their stories and then connect them with professionals or institutions that can help. But the victims should not be forced to talk about their trauma, and using negative expressions can only worsen the situation. Promises that cannot be kept should also not be made.
Trust is a crucial element. When one experiences the crisis of their daily life breaking down, they may quickly lose trust in themselves, others, and the world.
The National Center for Disaster and Trauma offers training for psychological emergency response in cases of disaster and trauma. It also operates a safe bus that allows mental health counseling directly at the site of the disaster. Experts in mental health say that emergency psychological support doesn't have to come from professionals, and that in such situations, it is more important that the victims stay connected. Eun-jin, Arirang News.